Good afternoon, everyone. Thanks for joining us today. We're going to give everyone about another minute or so to filter in here, and then we'll get started. All right, so we are a minute after, so we'll go ahead and kick off here. Welcome to our December Town Hall, Turning Insights into Action, Lessons from the 2024-2025 MSD Solutions Index. My name is Katie McCory, and I'm a Senior Program Manager for the National Safety Council MSD Solutions Lab, and I'll be your host today. And thank you, everyone, for joining us. We have an engaging and informative show lined up, packed with insights from the MSD Solutions Index, an annual survey launched by the MSD Solutions Lab designed to evaluate an organization's MSD prevention initiatives. Next slide. Let's see here. Okay. First, let's start off by reviewing our agenda. We'll begin with a bit of an introduction to the MSD Solutions Lab, and then I'll pass the baton over to the director of the lab, Paige DeBello, to walk us through findings and key takeaways from our recent MSD Solutions Index Pledge Community Report. Paige will then moderate a panel discussion with leaders from 3 of our MSD Pledge organizations who have taken the MSD Index year over year, including Dana Schultz with Superior Tubes, Dave Brody with Cargill, and Randy Million representing a municipality within Wyoming. Each will share their insights, challenges, and successes related to MSD risk reduction, safety culture, and innovation and collaboration. And we encourage you all as attendees to utilize the Q&A feature to engage in today's panel discussion. And we'll conclude our presentation today with a few updates from the lab. As you all may know already, MSDs are the largest category of workplace injury. Not only do MSDs take a physical and psychological toll on workers and their families as one of the leading causes in shortening employees' working years, but MSDs are also costly. According to the 2025 Liberty Mutual Workplace Safety Index, private businesses in the U.S. lose nearly $19 billion each year in lost wages and medical expenses due to these injuries. It's for these reasons that NSC, with funding and support from Amazon, established the MSD Solutions Lab in 2021. Our mission at the lab is pretty simple. We want to eliminate MSDs from workplaces worldwide so workers can spend more time doing the things they love with the people they love. The lab's strategic approach to accomplishing our mission is to focus our work within 4 pillars. The first of these is engagement, where we aim to meaningfully engage safety leaders, workers, and experts in this space to move the needle. Next, we focus on research, aiming to better understand MSD-related risks and effective solutions. The work supports the creation of free resources in an effort to create practical change. Our third pillar here is where we focus our efforts on supporting the development and implementation of innovative solutions to mitigate MSD-related risks in the workplace. And then lastly, we just really want to sound the alarm on this complex and pervasive safety issue. So we seek to build awareness and also amplify our work. Before we jump into today's presentation, I wanted to touch on the lab's groundbreaking initiative, the MSD Pledge. The pledge was launched in 2022 as a call to action movement where we invited employers to commit to reducing workplace-related MSD risks. There are many exclusive benefits that come with being a pledge member, such as having a connection to a community of like-minded peers dedicated to enhancing workplace safety and gaining access to exclusive offerings through the MSD Solutions Lab, including benchmarking events, pilot grant opportunities, and the MSD Solutions Index, which is the topic for our event today. The pledge community continues to grow and includes over 270 organizations throughout the world, covering nearly 3 million employees. For the pledge organizations joining us today, thank you for your commitment to workplace safety. We encourage those of you who have not yet signed the pledge to check out the MSD Pledge page to learn more. You'll find that link here in the chat. And now I would like to turn it over to Paige DeBelo, the director of the MSD Solutions Lab, to dive into our topic for today's event. Take it away, Paige.
All right, thanks so much for that intro, Katie, and really well said. And like Katie mentioned, I'm excited to jump into discussing the MSD Solutions Index with you all today. So let's introduce the index here. The index is designed to measure MSD prevention at the organizational level with the added benefit of being developed by a third party, NSC. It not only provides organizations with feedback about their risk reduction initiatives, but also provides feedback on some less focused on factors of MSD prevention and mitigation, like workplace safety culture, organizations' level of innovation and their tech readiness, and other non-physical risk factors of MSDs. And the MSD Solutions Index also provides benefits to MSD pledge members as well, including their ability to benchmark or compare results on the index with other companies, their ability to track their own MSD prevention progress over time, since the survey is something that's taken annually, and organizations receive an individualized report that highlights their areas of strength and also areas for opportunity. And it holds organizations accountable to those pledge commitments that they take when they sign the pledge. And so after many rounds of item development and review from industry and academic experts in ergonomics and MSD prevention, we ended up with 46 items focused on 3 subsections. So risk reduction, culture of safety, and innovation and collaboration. So for risk reduction, there's an example item here, but other items address top risk factors and also current MSD program features. For the culture of safety subsection, an example safety culture item is here again, but other items include things like frontline worker involvement, the communication of the importance of MSDs within their organization, and also trust between various levels of the company. And then there's also an innovation and collaboration subsection. So again, an example item here that's focused on tech use, but there's also other items within that section that are focused on sharing of metrics and also sharing of solutions, both within an organization and with organizations external. And so moving to the next slide, this slide just shows that what some of that feedback looks like that organizations get after they complete the index, including a visual of their overall score that they get on the index and scores that they get on those subsections that we talked about. So those categories of scoring are innovating, proactive, advancing, reactive, and novice. There are also some snips of example data visualizations and feedback that's provided within the individualized reports that companies received after completing the index that you can see here. So now, looking at the organization level results for the 24-25 cycle of the index, we'll look by subsection, we'll talk about areas for celebration and areas for improvement, and then we'll discuss some trends we're seeing from organizations who've now taken the index 3 times. So looking at kind of who the participants were this year, we had 42 organizations that participated in the index in 2024-2025. The survey was completed by 1 representative of the company, though collaboration on index completion was encouraged, and we did hear of this happening in a few organizations. Respondents received a link to complete the survey via email and could complete the survey in multiple sittings if they needed to verify their answers with others in the organization or if they just needed more time to respond. Most organizations who took the index last year were either from manufacturing or the professional, scientific, and technical services industry. Also consistent with last year's data, most organizations were large in size. So for the purposes of this survey, we defined large as having 1,000 or more employees. We also saw that 2/3 of the respondents mentioned that they had at least some of their staff working remotely, which is significantly up from last year's results. That number was in the 50s last year, and so we saw a big jump in folks mentioning they have workers working remotely, which also, we know offers a different set of risk factors. And most of the responding organizations, consistent with previous years, were headquartered in the US. And so we're happy to see a sustained increase in organizations who indicated they had an ergonomics or MSD prevention program, with about 86% having some form of a program this year and 83% indicating they had a program last year. Also, we're still seeing that differentiation in how people talk about their MSD prevention or ergonomics programs within their organizations. So some folks indicate they have one or the other program type. some mention that they don't differentiate between those two program types as well. So you see that represented here in this donut chart. And so moving to the next slide, the index was analyzed in subsections and as a whole. So in terms of our whole kind of overall index results, the graph on the left shows the breakdown by results category. So as a reminder, these categories range from novice to innovating. So half of respondents fell into the proactive category with their overall results. This shows that the pledge community is doing well in MSD prevention, but still has some room for improvement. And we're sustaining some momentum from the 23-24 results. We see again that some organizations in this past year had an overall score in that innovating category, which is really exciting to see. But importantly, these organizations, they're not done. They still have ways to improve, but we do like seeing some of that more maturity in folks' MSD prevention strategies within their organizations. Some other findings here show important relationships between MSD prevention efforts and an organization's overall MSD prevention maturity. So organizations had higher scores on the index that indicated more MSD prevention maturity when they stated that they design human factors into their work processes and purchasing decisions, when they provide ergonomic tools and equipment to their workers, when they just generally involve their frontline workers in work decisions, when they track leading indicators more than they track lagging indicators, and also simply just when they measure risk reduction within their organization. However, we did not find a significant relationship between overall index results and the industry an organization falls into, an organization's size, or how long an MSD program has been established within an organization. So that MSD program tenure not having an impact on overall index results. And so I think these findings are really encouraging because it shows that organizations can do well on their MSD prevention journey, even if they're a small company or even if they're just starting out on their MSD prevention efforts. And so moving into the next slide, this first subsection that we'll talk about is the risk reduction section, which contained items covering those topics that I mentioned, like risk factors within a workplace or also their current MSD program features. And so as you can see in the graph, the results for this section were slightly skewed with more organizations scoring favorably on this section. Most results fell under the proactive category in this section this year, whereas in the prior 2 years, most results fell under advancing. So a little bit of movement there. Analysis also showed some positive correlations between your risk reduction results and an organization's size, if they have risk reduction goals in place, and if they utilize technology within their organization for MSD prevention. These results make a fair amount of sense, as we might expect that larger organizations might have more resources to devote to things like risk assessments and technology. We also see that having set goals around risk reduction is a really important step to impact risk reduction within the workplace. And so consistent with year 2 data, we saw that leading indicators, so things like program audits and early reporting, were more commonly tracked among the MSD pledge members completing the index than they were tracking lagging indicators, such as OSHA 300 logs and workers' compensation claims. So this is also a really nice trend that we're seeing in that switch to tracking more of those leading indicators and lagging indicators, which has really been a through line in workplace safety and health. And finally, we see that over 85% of respondents utilize employee feedback to determine where improvements are needed in the workplace, which is great to see. And the percentage here has risen year over year, showing that organizations are maybe understanding more about the importance of involving their frontline workers in solution development. So another nice trend there. And so moving into the next slide, we'll talk about the safety culture subsection. So the results here were a bit higher, which is similar to previous year's results as well. As shown in the graph, the majority fell into the proactive category in this subsection, showing more developed safety culture across respondents. Analyses also showed many correlations between safety culture results and other relevant variables. So positive correlations between safety culture and things like having methods in place for your workers to speak up and share safety suggestions. Also correlated with the extent to which human factors were designed into their work processes, if they were provided, again, with those proper ergonomic tools and equipment. Also correlated with the level of trust that is seen between workers and employees that are at other various levels of the organization. Correlated with frontline worker involvement in determining changes that might be needed within their workplace, and also with the use of employee perception surveys. We also, here on the next slide, pulled out a couple of specific responses to 2 items in this section as well. One item asked to what degree frontline workers were involved in decision-making regarding various work practices. So responses on this item indicate that frontline workers are most involved in decision-making concerning their job tasks and workplace cultures, but that they were less involved in their schedules and their workflows. The other item here showcases us asking about non-physical risk factors that might be influencing MSDs within an organization. Since we really know that MSDs are multifaceted, caused by more than just those physical risk factors. And so some commonly cited non-physical risk factors that folks chose were things like mental fatigue, a high mental workload within their organization, maybe having a lack of training, a lack of staff around them, experiencing workplace stress or poor work-life balance as well. And this 98% figure indicates a sustained significant increase over year one data, in which closer to only 80% of organizations mentioned that they thought that non-physical risk factors were impacting their MSD rates within their organization. And so we see that more organizations seem to be recognizing that it isn't only those physical factors that can lead to MSD risks. And so we'll want to keep tracking this and share some of our work on non-physical risk factors with those in the pledge community, just to keep that awareness high. And so lastly, moving into our last subsection here, the innovation and collaboration subsection. In comparison to the safety culture subsection, the results on innovation and collaboration trended a bit lower. However, we are seeing huge strides, in the overall results for this section in comparison to previous years. So last year, the majority of responses fell in that reactive category, so kind of under the average here. Yet this year, while the data are still spread out, most are falling into that proactive category. So a nice shift that we're seeing here with a more of a focus on innovation and collaboration within the pledge community. In terms of innovation, the vast majority were involved in technology for MSD prevention in some way or another within their organization. So 33% of organizations reported that they use technology for MSD prevention, 12% were trialing that tech, and 31% were in varying stages of researching different technologies. And so we know that technology remains a major topic in the safety and health space, and that many folks are trialing or implementing tech for safety efforts. And so this is an area that we see as a place to continue to devote more resources and opportunities and attention. But interestingly, the number of organizations actively utilizing technology is up this year, while some of those numbers for trialing or researching are a little bit down. But I think that exemplifies a trend that we're seeing toward more folks actually adopting this within their workplaces, which is kind of cool to see. And so lastly, this year, 95% of organizations mention that they share effective solutions internally, while 71% share effective solutions externally. And these numbers are both up from year one data, indicating some strides in collaboration for those in the pledge community. And so moving here to the next slide, now that we have 3 years of data, we can kind of compare a nice longitudinal look at the index results that we have. And so first, just to lay the groundwork here, 43% of organizations who took the index in 24-25 also took it in 22-23 and in 23-24. This number is slightly impacted by the fact that some organizations who took it just this past year in 24-25 might have not even been pledge members in some of those previous cycles. So they obviously can't be included in this 3-year look that we're doing. But thought still sharing that 43% is a little bit meaningful to understand some of these results. And so looking at some of the comparisons of scores this year and in the previous years, we're seeing a couple things here highlighted on the screen. So 72% of organizations had better overall index scores in 24-25 than they did in their first year, so 22-23. Risk reduction scores were improved for 56% of organizations across that 3-year period. 78% of organizations had higher scores in the safety culture subsection over that 3-year period. And innovation and collaboration results were also higher for a majority of organizations over the 3 years. So overall, some of these trends are showing us that it seems like sticking with the pledge and continuing to engage in the index, those organizations are seeing improvements in their MSD prevention efforts. And so while we know there are a lot of factors that could contribute to the strengthening of an organization's safety and health program, the provision of the individual reports based on index responses, and those resources that are available to our pledge community members and the public appear to be making an impact. And so now that I've gone over findings by sections, I want to dive a little deeper into areas that we have identified as being well developed in the community, as well as areas that could use a little more dedication and focus in the future. So starting off with some areas of celebration and looking to the risk reduction section, half of respondents rated their workplace's ability to prevent MSDs as good or excellent. And while usually these self-report measures can kind of be taken with a grain of salt, we do have some support for these self-ratings, so supported by correlations, showing that those higher self-ratings are actually correlated with higher scores on the overall index and those index subsections. So a bit of justification for that overall rating. Further, those who are tracked more leading indicators as opposed to lagging indicators saw significantly better results in all subsections. I know that I'm sure we can all agree that preventing injuries before they happen is better than just reacting to those after the fact. So this finding of the more leading indicator tracking is really encouraging and something that we'll continue to support within the pledge community. And let's see, moving into our next finding here, something else to celebrate is the vast majority of those who have completed the index do have some type of ergonomics or MSD prevention program in place. This is another item that we've seen growth on throughout the years of organizations actually mentioning that they have these types of programs and efforts in place. And as for an area of celebration within safety culture, 64% of respondents currently conduct employee perception survey. Also, over three-quarters of respondents have methods in place for workers to share safety improvement suggestions. So it can be argued that no one knows the risks of a job better than the person who's doing it day in and day out. So that employee feedback piece is really important. And also employee surveys and receptiveness to that feedback that you get from those employee perception surveys and having the opportunity to address those concerns are really a great way to build a strong safety culture and a psychologically safe environment within your workplace. And finally, for areas of celebration within innovation and collaboration, our main finding relates specifically to innovation. So 45% of respondents are either using or trialing technologies in their organizations. And so a unique opportunity I did want to highlight here is the MSD Pilot Grant Program, which we can drop a link to that in the chat. But this is an opportunity for organizations to trial innovative technologies for MSD prevention in their own organizations. And so these grants can supply up to $20,000 for organizations to trial an innovative technology in their own workplaces. And so if you check out that link in the chat, you can learn a little bit more about the grant opportunity and reach out to our team with any questions. We're also proud of the amount of solution knowledge sharing that's happening and want to continue to encourage this. So that kind of last line here. But also, in addition to those areas of celebration, we've also identified some opportunities for improvement. So, for starters, we are seeing that some percentage, so 14%, do not currently have an ergonomics or MSD prevention program in place. This is definitely an important step in organizations' MSD prevention journey. So, an area that we recognize we need to devote more time and resources to. We do have some resources on our website regarding developing MSD's policies and procedures, and also other foundational resources that could help you get started on your MSD prevention efforts if you fall into that 14% without an ergonomics or MSD prevention program currently in your organization. Also, we see that over half of respondents do not have risk reduction goals in their workplace, which that number is up from previous years. So really having those actionable goals is also a really great first step to be taken in your MSD prevention journey. So an area we want to offer more education and resources for. And finally, a majority of respondents reported they believe non-physical risk factors play a role in the incident of MSDs in their workplace. But most of those recognize that it's playing a role, but they're not actually measuring the presence of those factors, which was something that we need to dig into a little bit more within some of these data. And so going to the next slide, this all finally leads us to a few practical implications that we can take away from the index findings. So first, we need to encourage continued sharing of effective MSD solutions externally. Also need to engage organizations in the pilot grant process to trial emerging technologies, given that we still have some room to grow there. We also need to do some work around deepening frontline worker engagement and better understand frontline worker involvement, which has been a focus of the lab this year. And to better understand the impact of those non-physical risk factors, organizations should start thinking about ways to actually measure those factors or assess for those within their workplaces. And so that'll wrap up my review of this year's index findings. I know that's a lot. I know Katie will mention it later, but our report on this did come out just today. And so we encourage you all to read that report and dive into it more a little bit if you want to get into the nitty-gritty. But I'm ready to dive into the next portion of our program here today. And so we'll be able to talk with folks who've actually experienced taking the MSD Solutions Index, who can provide some thoughts about their experiences doing that and also their experience just generally with MSD prevention within their organizations. So with that, I'd like to invite our panelists to join us on camera as we segue into the panel portion of our event. All righty. Thank you guys for joining us today, Dana, Dave, and Randy. And so to begin, maybe each of you can briefly introduce yourselves and your organizations and explain a little bit about your involvement with the index for the past 3 years. So I'm not sure if someone wants to kick us off. Dave, I see you're off. Do you want to go ahead?
Sure. He's always like, all right, who's going to say it? I'm David Brody, advisor, basically corporate ergonomist for our Food North America group. our ergonomics, corporate ergonomics team, there's two of us that help manage the program across 36 sites here in US and Canada. So our population is just shy of 30,000 employees. The population that I focused on within Food North America was what we call our protein business, which is essentially our meat processing operations. That was our highest risk operations. That's where we had our strongest program, the one that's been running for the longest period of time. So everything that we did about the index and the initial work we've been doing over the last, it's up to 15 plus years now that we've had the program running, has been around that business.
Thanks, Dave. Want to go ahead, Randy?
Sure. I'm Randy Milliron. I work for a small municipality in Northeast Wyoming. Been partnered with the MSD Solutions Lab for about the last 4 years, I believe. That's pretty much it.
Thanks, Randy. Over to you, Dana.
Yeah, my name is Dana Schultz. I am the HR and safety manager and at a small manufacturing facility in Davenport. And really, everything that Paige just walked through is exactly what my business did. I did not have a background in safety, but saw that we really needed to have an intentional focus on it, and then came across the MSD pledge in 2022. And that's the first year that we took our MSD index, and I'll dive a little bit deeper into that and how we utilize that. But the results that Paige just went over really is how we navigated that. And as a small business with limited resources, the MSD Solutions Lab, the index, all of that was really valuable as a free resource for us to be able to have a successful safety program.
Well, thanks, Dana, so much for that. And I appreciate everyone being here today. And I think, Dana, let's just go ahead and dive right in. I think you kind of teed us up perfect for one of our first questions here. And I'll just mention that we got some questions that we want to get to with our panelists. But if you all have questions within the audience, we encourage you to drop those in the Q&A and we can just get to those as time permits. But Dana, let's go ahead. You kind of alluded to, but maybe if you could just kind of walk us through a little bit more of how the MSD Solution Index findings have influenced your organization's understanding of MSD risks and also worker well-being within Superior Tubes.
Yeah, like I mentioned, I didn't have a safety background. I didn't really know where to start, but I knew MSDs were our most frequent injury and our most costly injury and has the biggest impact on our workers. And so I came across the MSD pledge and ultimately the MSD Solutions Index. And so what that did for us, it gave us a benchmark to our true starting point. We had a couple of things in progress when this happened, but other than that, we had a really non-existent reactive safety program. So it highlighted our gaps, not just in risk control, but in culture, early reporting, consistency, and that innovation piece. It also validated where we were, what we were already sensing. We knew that we had high exposure of repetitive motions, awkward postures, twisting and bending in our mechanical bending and welding areas. And so the index was able to clarify for us kind of the biggest barrier when it came to like lack of structured data or resources, consistent tools. And so I didn't know what I didn't know. And the index guided me into, you can do this for an indicator, you can do this for a program, here's this culture survey that we created for you that you can hand out. And so it pushed us over the years towards a more proactive risk reduction, aligning to that commitment in the MSD pledge. But it guided us and supported us into the pilot grant that we did eventually get and achieve that innovation and collaboration through external and internal partners.
Thanks so much for sharing, Dana. I think you guys have such a great story over there at Superior Tube Products of how you really use some of this to kickstart, your program and really understand where those risks are and then how to make some improvements based on the index data. So really appreciate you sharing that. And so Randy, I'll toss it over to you. Same question, how have the MSD Solution Index findings influenced your organization's understanding of MSD risks and maybe subsequently worker well-being?
Okay, well, thanks. It's interesting because we have been involved with the group for 3 or 4 years. And for me, it's neat to see the marked improvement we have in the various different categories. So it was really neat to see how we've changed in some of those areas. And then it also gave us the opportunity to look at areas where we need to focus. So taking that data, we actually use that to change kind of our lineup for our large summer safety event, which I'll talk about a little later. And the only way we could do that is from the data that we got from the report. It showed us where we needed to focus more of our efforts at. So it was really appreciative to be able to have some data to back up the decisions we were making in moving forward with our safety training.
Yeah, thanks for that, Randy. And I think that goes in nicely, with this. Maybe you already have an understanding of MSD risks in your organizations, but taking something like the index could really maybe validate some presumptions that you might already have about what's going on in your organization. So it's kind of that nice third party look at what might be going on. And so, Dave, moving over to you to kind of piggyback off of that concept, but in what ways has the index maybe validated or even challenged some of your existing MSD prevention strategies or your perceptions of what you guys are doing to prevent MSDs?
Yeah, I think one of the things with Cargill, so when we started with the index, we had already had a program running for close to 14 years. So that really what the index was trying to help was why we went into it. What we were hoping to see is that we were living in our own world for all that period of time. And the availability to have all the people that went into creating the index and being able to use that third party with a lot of experts that created these questions to go and basically let's challenge ourselves and see what are we doing and where are we at. And obviously going in, we're hoping we weren't going to come in as novice type of thing with where our program was at. So we were happy to see that we had achieved proactive. That was a solid state for where we were hoping that we would have been at that period of time. If we had taken this index 12 years ago, we would have been novice. We were very basic back then, but it takes time to build, especially in an organization of our size across that many sites. My only thing I would have loved to have done, but I know it was just too challenging for all involved, is I would have loved each plant to have done their own index, because the reality is not every plant is at the same level. Overall, we're proactive, but I would say a few plants are probably closer to advancing or might even be one level down from that to kind of say, but we're all building in that direction. And that's part of the reason why we stayed proactive throughout all 3 years, is that on average, we're all getting to that stage.
Yeah, thanks, Dave. I appreciate those insights, and I get that site level data can be helpful sometimes. I know that's something that we noodled back and forth on. Can we do this? Can we not do this? And we would love to explore that with organizations if it's something that they're interested in too. Just how can we get down to the level of data that folks are really needing to make the most impact? But appreciate you mentioning some of your experience with the index and how it helped to give that third party look of what you guys are doing at Cargill. And so, Dana, I'm going to bring it back over to you. And so this time, kind of getting into one of the more core components of the index, like we talked about, that risk reduction subsection. And so maybe if you could share a specific risk reduction initiative that your organization has implemented and the impact it's had on, MSD related outcomes in your organization.
Yeah, so the index kind of guided us towards the pilot grant. And so we applied for that. And it allowed us to partner with 3Motion AI, a video-based ergonomic assessment technology, something that a small business like us couldn't afford otherwise. And so when you really take a look at all the ergonomic assessments that you have out there and how much time and actual knowledge needs to go into having those correct, this technology really allowed us to streamline that. And so we used it and established risk priority numbers for our work cells to try to determine what our highest areas were. We had injury and near miss data, but this kind of validated this in a different way for us. And it gave us a repeatable way to evaluate those solutions or those incidents. And what I initially did with this was follow what I thought would have been the biggest risk. We lift heavy steel tube, but in this we found that it was another area that actually had the highest risk. And so we brought our employees together to see the data and the reports that this technology provided us. And a partner with 3Motion AI joined us with that, and we got to walk through the whole assessment, pinpointing different areas that we could focus on and let them come up with their own ideas. And and honestly ended up being really simple. Instead of us, designing all these fixtures and racks and lifting devices, we bought a $45 solution. We needed a shorter wash bay wand. to be able to bring our team back into our neutral zone. And by doing that simple $45 solution, we reduced the risk in that area 65%. And not only did we do that, but then we started to really see our team want to suggest other things. And so we reduced the ergonomic risk there, but we also ended up reducing trip hazards through their solutions. And so it was a really great way that we reduced the risk, but also really engaged our team in participating with the solutions for their day to day. And in the end, the employees were happy with the solution. They reported less fatigue, improved flow, and really just greater ownership of the safety improvements that we were doing.
Yeah, thanks for sharing, Dana. And I love that example. I think it touches on a lot of great components that I think, you guys have been learning in your MST prevention journey and the connection between the technology, the innovation piece, but also how that impacts, your risk reduction. I think that through line is really there. And also the participatory ergonomics piece that I think you're, highlighting a bit too, getting your actual workers involved and having them do some of the solution development piece. You guys could have, like you said, over-engineered, something that maybe you didn't need in order to reduce your risk really substantially with just the wash bay, wand edit there. So really, really cool example. And I like how it touches on your workers too. And it sounds like even just that instance of getting them involved kind of spearheaded their involvement into other areas of helping you guys develop solutions too. So really kind of creating that culture there. So yeah, really nice holistic example. Appreciate it. And so, Randy, let's maybe move back over to you to share a little bit more about maybe one of the other kind of tenets of the index, so that safety culture piece. And so maybe how have you guys over at your organization worked to strengthen your safety culture around MSD prevention?
Yeah, that's a great question. For us, it was interesting because every year we put a lot of planning into this large event. It's called the June Safety Day or Safety Training Day. And in the past, we have our employees rotate through stations doing different tasks and stuff. And so based on the insight that we got from the MSD Solutions Lab report, we decided to change our complete focus. So normally we would have, let's say we have 3 or 4 stations that our employees are going to rotate through. Normally in the past, maybe it was going to be one of those stations. Well, this year we decided to have all of the stations be ergonomics. So we were actually able to apply for a grant, and we were able to bring in our keynote speaker, Lori Frederick from Biomechanics Movement, and she delivered a keynote on the importance of stretch and flex programs. So that was one of the opening sessions, and then a secondary session, we also had Alex Smith from Dorn Companies come up, and it was interesting that Dana talked about 3Motion AI because he actually did a whole presentation on the benefits of using an app-based program like that. That real-time meaningful data that you can actually use for coaching employees while they're doing the task. So, and then on the other side, we kept Lori, and she had a station that was going to cover basically the use of rock tape and different innovative things that you can do, low cost things that you can do to improve, really increase the reduction of MSD injuries. And then not to leave me out of the loop, we have a body mechanics training called Safety in Motion. That was the the third station that we had, that I basically took them through the 5 re-energizer exercises that anyone can do anytime throughout their day. So, and whether you're a lineman or a police officer or a receptionist, whichever job you have, it gives those things that periodically throughout their day, you can get up and do these simple stretch flex exercises to improve the blood flow and circulation and reduce that achiness that you have at the end of the day. So I really appreciated, obviously the report gave us great insight to move in that direction. It's funny that, with NSC, there's a lot of talk about benchmarking surveys and also the MSD Solution survey. But when we presented a survey to our employees, I mean, we had over 120 employees attend this event. So really broken up into 2 different sessions, one in the morning and one in the afternoon. And the survey results that we got back, they really liked the hands-on, the involvement rather than just, getting to, watch a presentation. So it was great to take the insight we got from the report and change our overall, our event that we have every year. So that was really a benefit for our employees. And it seemed like, looking around and talking to the employees afterwards, they really appreciated the effort that we put forward in completely changing the lineup for our big June safety training day.
Yeah, I love that, Randy, and how, it seems like some of the index data helped you guys understand better your own internal alignment on what's important to bubble up for your safety training day. And it sounds like that really landed with your employees too. So I think it's just another cool way that those data can be used. And it sounds like y'all had a really successful safety culture
Yeah, it
day.
was
So that's
fun.
awesome. Yeah. Well, cool. And so now, Dave, I'm going to kick it back over to you to talk about another kind of key component from the index, so that collaboration piece. And so the index, like we know, emphasizes the sharing of effective or even ineffective, solutions that organizations have put into place, whether it's sharing those internally or externally. And so for Cargill, how have partnerships, whether with internal teams or external experts, tech providers, or other organizations, really supported your MSD initiatives?
Well, for us, I mean, honestly, we looked at the opportunities that came out of the lab, and the goal was how do we use it all as much as possible to basically advance what we're doing. So being able to participate in benchmarking sessions, the meetings that occur, to be able to interact with other businesses, to understand the questions that we're all dealing with. And I think the value there was that it continually validated with us that we're not so far off, that we all have similar concerns, similar challenges, and that we're all working down the same path. We always, honestly, in our business, we always feel like we're a little behind in the program development, but it started to give us that real confidence that we're in the right place. With it, beyond that, the grants that were available through the National Safety Council allowed us to do a couple of really important pieces of work that advanced what we wanted to understand for Cargill. The Research to Solutions grant gave us the opportunity to collaborate with a university at a level we'd never been able to do before. We had always done small little projects internally to do some really minor research studies or validation of technology. But this allowed us to do a very long uh, partnership with the University of Waterloo to evaluate computer vision technology. We were already using it, but we wanted to be able to instruct our plants anything that they should know, anything that they should change on how we're using that system to make sure we're using it the best way possible. That's something that we couldn't do internally. That we didn't have the resources, we didn't have the lab, we don't have that type of expertise that you can get at a university. And being able to partner with the teams at Waterloo were able to help us do that incredibly well. To the point where now we've actually finished that project and we're about to start the next project, which digs into, I'll be honest, that project is probably one of the things that will take us from proactive to innovative in how we look at metrics and how we look at how to address risk within our plants. So we're already using a lot of technology within our data collection process and how we look at risk. Uh, this is going to help us capitalize on that information to a higher level. And for us, the other value of that is we're able to do this. And the good thing with these types of grants and research is that it's not just for Cargill. When we do this work, it becomes published, it becomes available and shareable to everybody. And that, to me, is one of the huge pieces of this is that when you're doing something like what we're doing with the Solutions Lab and the Index, it's not about how do I just make Cargill better, which is obviously one of my priorities, but also can we make ergonomics better and can we reduce injuries, help people get better? And this collaboration that we've been able to do over these last few years has taken us to new levels that uh, really has energized what we're doing within Cargill.
Yeah, appreciate that, Dave, and appreciate you touching on the grant portion too. I know that was huge, and that you guys came up with such a great, deliverable from your project with Waterloo on computer vision and correct angles for computer vision technology and the like. So just appreciate all that you guys are doing to stay connected to other folks and really kind of push the boundaries, not just for Cargill, but also for other organizations and their MSD prevention efforts. I think you guys are exemplifying that really well. And Dave, I'll actually stick with you for this next item, and then Dana will pop back over to you for your perspective on the same thing. But Dave, if you could tell us, looking more holistically at your ergonomics and MSD prevention efforts, maybe, and you might have just touched on some of these things, but what successes or milestones are you most proud of in your MSD prevention efforts that other people, who are here listening today might learn from?
you hate to use a lagging indicator. It's kind of like a huge milestone, but for our organization and for if anybody, I mean, meat processing is one of the highest risk uh, businesses out there. There are a couple others that are in our range, but we had a tough business. And when we started, our injury rates were very high. And it took us a long time to get it down. And to be honest, if we looked at the graph of our injury reduction, it kind of reminds me of when you start to watch yourself losing weight, where we had a great initial drop and then we plateaued for a while and we're sitting there as like, what do I do? What do I do? And the milestone and the key thing that we started to realize was that it wasn't that we weren't doing anything wrong. It's just that we were still getting better. And there were little things that just weren't being done to the full potential. And what happened was, and especially after COVID, when we were able to re-engage at a high level, is that a good portion of our plants were able to implement all of the pieces of the program, including our occupational health teams, our operational teams, our supervisors, all the way through our EHS teams. Everybody was able to start doing things to the level they wanted to and the things they recognized. And all of a sudden, that was the one piece. It's kind of like your diet where you're like, don't want to give up that last thing, or I don't want to exercise that extra 60 minutes this week. But when you start doing it, you start to realize that was what I needed to do. And we got over that hump. And that's what allowed us to achieve our goal. We walked into the index not knowing, I mean, it was a goal. We know we wanted to achieve that 25% reduction, but we've been stuck and we'd already dropped by almost 65% our injury rate. So we're like, can we, is it there? And when we got to that point, we got to the end of the 3 years and it was like, oh, wow, we actually did it type of thing. And we're continuing on that process that actually so far we're 2 quarters into this fiscal year and we're 27% down from last year from where we were. So we are at the lowest we've ever been for MSDs in a meat processing organization. We have beef plants that have months with zero in MSDs. When you think about the type of work we do and say, if we can do that with what we do, everybody can do this. So those zeros may not happen every month, but they can happen. Those injury reductions, they can happen. We can all do it type of thing if we follow the process. And that to me was the milestone in the process that solidified what we're doing and how I wanted to move forward with how we're progressing with Cargill.
Yeah, thanks for sharing all that, Dave. I think really impressive numbers that you guys have achieved, and just really appreciate all that you're doing within Cargill to lower those numbers. And then, like I said, share some of that information out. I'm sure that lots of folks can learn from what you guys are doing over there to try to implement in their own organizations. And so, Dana, I'll just pop the same question over to you. What are you most proud of, or what is maybe your biggest success or milestone within MSD prevention efforts that other folks could learn from on the call?
Yeah, since we're really 3 years into it, and so it's kind of all of it because it was such a hard journey to get to where we are today. But really that shift from a reactive safety culture to a proactive one that's engaged and it's driven by data. Once our employees started to see the small wins, the AI data, the success of those low cost fixes, they began to continue to suggest additional improvements on their own. And I became more of a consultant than a driver for the safety program. And that was kind of cool to see them tell me, hey, this happened and this is how we fixed it. And it was the right thing to do. And the project, with the 3Motion AI grant, proved that innovation, isn't always expensive. Sometimes it's just the right framework, the right people, and the right data that really unlocks a powerful transformation for a company. And through all that we did and all the partnerships, again, external and internal, we did have a lot of drops in our lagging indicators. Our early reporting increased. Our total recordable incident rate dropped over 60%. Our worker compensation costs dropped 98%. And then finally, the one thing I guess I am most proud of is my EMOD. When I started, it was so high, and we were able to work over this 3-year period to get it dropped 36% to where now, we get a discount versus an insane increase for our insurance rates. And so from a company standpoint, the bottom line, that's really important. But it was all the things in between that I'm most proud of. And to watch our team go from kind of hesitant to talk about it, hesitant to live it, to just wanting to be a part of it. I'm being really proud of what we've done here.
Yeah, thanks, Dana. I love that you talk about the steps that it takes to get to those huge 98% reduction in workers' comp. I mean, that's something to definitely hang your hat on. But I think I love that you're highlighting it's all the little steps that it took to get to that place that are really something to be proud of, and making those implementations and then having it sound like, your employee, your leadership buy-in on the importance of doing this work and the actual positive outcomes that come of it. Not just within safety, but within other areas of the organization too, is huge. So just big kudos to everything that you've done over at Superior Tubes. And so, Randy, kind of switching gears a little bit here. I know we have about 9 minutes or so left, but I'll swing back over to you, Randy. What is maybe one practical, low-cost action that you see that organizations might be able to immediately take to strengthen their MSD prevention efforts, or things you might have learned, from your index data on that?
Did I hear you just give me 9 minutes to talk? Oh, great. I'm just kidding. For me, it's going to sound really cliche and pretty easy answer. Very low cost initiative you can do is complete your index. Really is to submit your data and really look at those trends that you're going to out of the different categories on how you're trending, really to use that report to in an effort to reduce your MSD injuries and illnesses. So that's the first thing I would do. And then what I like to do also is I like to share those results. So I like to share those results initially with my safety committee, kind of let them know, hey, because most of them don't know that, behind the scenes, I'm filling out this report, but it's nice to share the data with them. And then as we get farther in along in the process, I want to be able to share that same data with our senior leaders, because Paige knows firsthand that we've been really trying hard to apply for the grant because we see the reduction efforts that can come. I mean, we've heard it from David and Dana that we want to experience those same reduction in those MSD injuries. So I think that's the next step that we need to pursue, and Paige and I are going to work really hard together to get those senior leaders on board. But initially, you complete the index, and then once you get the report, really dive into it. And if there's anything that you don't understand, that's the thing I love about the NSC MSD Solutions Lab is they're there to help. So if there was a certain category, like I reached out to Paige looking over my results, and I go, I don't quite understand how we scored on this. And so she was able to explain that to me. So great customer support and customer help when it comes to those ideas or those issues that you see in the report that you may not really fully understand. Just like David mentioned, I would love to be on the innovative side. I mean, it's great that we've been on the proactive and that score keeps going up. That's great for us, but I'd really like to look at more innovative ways on how we can reduce these MSD injuries that we're having. So I think the report is a great low cost item that every organization should be using.
Yeah, thanks for that, Randy. I appreciate the kudos for the index. And also, I think you touched on something important too, getting that senior leadership buy-in, that this is something important to look at, and, maybe having that data piece to go and show them like, hey, this is why it's important, or, look at the areas for improvement that were recommended on our report and how, you could work together maybe to make some of those shifts. So I think
and
that's really important.
another thing, I mean, to kind of piggyback off your idea, which is, I guess, a piggyback off my idea, but is to show the results to the senior leaders, because maybe they don't understand that as an organization, our safety culture, we are in the proactive category. But hey, these are the things that we could do to get into that next category.
Exactly.
And the end goal is, in safety, we want to reduce those unnecessary and 100% preventable injuries. Well, this is another great tool. So to show them the results and show, hey, this is how we scored, and hey, here are the areas that we need to work on. Really getting them to buy into that report, and using that data from the report, how they influence the employees in their divisions.
That's awesome. Thank you, Randy. Appreciate that. And maybe we'll just go to you, Dave, one last time to share maybe some last nuggets of wisdom with the group here. But from your perspective, and I think with all you shared at Cargill, what maybe indicators or metrics do you think organizations should monitor to assess whether their MSD prevention programs are truly working, truly kind of improving that worker well-being?
It's always, I mean, I'll be honest. I thought about this question. It's something that everybody works on, and it's something that's evolved over time with Cargill. So our metrics have changed over the years. When we started out, our metrics were very basic because we had nothing. And as you get good at each level, we modify our metrics to push us farther. But what I'll break it down and just to very quickly say is that we always ask that we have both process related goals and outcome goals. Process is what is the work you're doing to achieve the goals? Are you doing the risk assessments? Are you doing the training? Are you doing the interactions with your employees? As your onboarding process? There's all kinds of things that you can measure. And it depends on your environment. Are you an office environment, a lab environment, a field-based environment? Those are going to change. So I can't tell you that there's one that's perfect on the process side, but you have to look at what you're trying to get done and say those, and not try and say, I got to be perfect this year. You have to say, what are the achievable goals this year that will move me down the road? You do have to have the knowledge of where do you want to be 5 years from now, but bring that back to what is achievable. Because what is achievable on an annual basis is going to impact what your outcomes are. You can't sit there and say, I would never have said we're going to reduce our injury rate by 25%. That's a ridiculous goal for a single year. I can't ask people to do that. But if you thought there are things we could do that these things will affect these many people, this many risks, and we had the capability to do that, then you can set your goals to match that. And when you look at some of those lagging indicators, I think the evolution that we're going to look at is that sometimes we just look at injury rates and I guess going to Dana about the compensation rates. There's a connection there that when you start looking at compensation and injuries, one of the things that we're going to start thinking about over time is those injuries that are the most severe that cause us essentially the greatest pain to our employees and the greatest cost to an organization. There should be work and we should be, for bigger organizations like ours, we have to start focusing on are we reducing high risk, high severity injuries, MSDs within our organization. We can do tons of little work. We can do tons of things that reduce tendonitis and smaller acute injuries, smaller cumulative injuries as well. But are we doing the work to get rid of those injuries that could be affecting the lives of our employees, not just for the amount of time for a couple of weeks to recover, but the ones where this becomes a life-altering injury to them. So that we have to focus on that and treat ergonomics at that level and go after those. So it's an evolution. We're getting to that point type of thing. It's not something you may be able to do initially. You got to go for quick wins initially. So the final thing I'd say is that build it out and be prepared to change it over time. Don't sit on that metric. It might sit for 2 to 3 years and then you got to improve it. Always push yourself and you always be pushing yourselves to go lower.
Yeah, I love that. I love the focus that you had on the process too. Again, it's those steps that you have to take to get to those goals that you want to get to. You can't just focus on the goal and then not have the right processes in place to actually get to that. And also, I think being transparent about that things might need to shift over time, right? I don't know, other metrics might become more important, or you might recognize that, oh, we need to go in this direction and not that direction to get to the outcome we want to get to. And I think just being flexible sounds like it's
If
really
we're
important. So I appreciate that.
if we're at 100% every year, then you're like, well, it's not really a goal anymore because you're not
Yeah.
improving. Okay, now we're there. Now what's next? So,
Yeah.
okay, how do I, now that everybody can do that, what do we do next?
Yeah. Yeah, appreciate that. And I know that we're almost at time here, and I want to pass it back over to Katie, but just thank you all, Randy, Dana, Dave, for sharing your insights here about not only your experiences with the index, but just MSD prevention in your organizations overall. Just really appreciate it and appreciate you guys joining us today. And so, Katie, back over to you to wrap us up.
Thanks, Paige. Just gonna share the slides here and go through a few last closing remarks. So moving on. Earlier, I touched on the lab's groundbreaking initiative, the MSD Pledge. Before leaving you today, I want to encourage you to sign the pledge if you haven't already and commit to reducing MSD-related risks at your workplace. As a reminder, this commitment provides organizations with free exclusive offerings such as access to the MSD Solutions Index, which we talked about today. So we welcome you to join our growing community of safety leaders, and you should be able to access the pledge through a link that was just dropped in the chat. And then also just wanted to highlight our resources here. As part of our efforts to support organizations in preventing MSDs, the lab leverages research to produce free resources focused on building effective MSD prevention programs, understanding MSD risks, and identifying and implementing MSD prevention initiatives. Today, we're happy to announce that we just released the latest MSD Solutions Index community report, which is now available on our website. And my colleague Riley will drop that link to access that in the chat. And just looking ahead here, we're currently working on a new report that's scheduled to be released this spring, focused on frontline worker perceptions of tech use in MSD prevention. So stay tuned there. You can stay updated on our work, including the release of new resources, by following our LinkedIn page, which you will find here in the chat shortly. Lastly, just wanted to give a special call out to a new event. So coming up this spring, NSC is uniting 3 premier events, the Future of EHS, the HOP Summit, and the NSC Spring Safety Conference and Expo. And this is being combined into one new event this year called the NSC Safety Summit. So at this event, the lab will be hosting a professional development workshop and a few education sessions, and we really encourage you to join us in Baltimore on May 6th through the 8th for what's sure to be an impactful event. With that, we'll go ahead and end today. Thank you again for taking the time to join us and for your commitment to workplace safety. Thanks to Paige for a great presentation and to our panelists for sharing your experiences and engaging in a great discussion. So have a safe rest of your day, and we look forward to seeing you all soon.